Okay, welcome everyone to our Older Adult Mental Health and Wellness series. We'll kick off with Supervisor Carson. And just a reminder, when we get to question and answers, if you'd like to ask your questions anonymously, you can put them in the Q&A box, and then we can address those anonymously. We'll also have the opportunity for you to raise your hand and ask your questions live. Okay, Keith.
Good evening, and I want to thank everybody for taking time out of your busy day to join us for the last of our 4-point series that we've had with respect to community mental health and our health webinar series that we've hosted. We wouldn't have been able to do it without you signing in and checking us out, and so we want to say a big thank you for taking the time to do that. Also, I want to say a big thank you to Amy Schrago, Chief of Staff in our office, for putting together this incredible series on mental health here in Alameda County. We've had wonderful presenters and experts who have imparted and shared information with hundreds of people who participated over the last month on this series. And so you will be able to also go online and download previous presentations, and we would encourage you to do so and share them with your friends and neighbors and family. My name is Keith Carson, and I have the privilege of being the president of the Alameda County Board of Supervisors, and I represent District 5 in Alameda County, which is Albany, Berkeley, Piedmont, Emeryville, and about a third of Oakland, including West Oakland, North Oakland, Montclair, and some of the San Antonio area. Last week, we heard from Dr. Erin Chapman, the medical director of the Alameda County Behavioral Health Care Services, and Stephanie Lewis, division director for Crisis Services of Alameda County Behavioral Health. They walked us through the steps, the tools, and the resources that are available to all of us to assist someone experiencing a mental health crisis. Globally, the population is aging rapidly. Between 2015 and 2050, the proportion of the world's population who will be over 60 years of age will double from 12% to 22%. Just on Monday, when the Census Bureau released the early numbers, it showed that there are now more than 80 million individuals that may be older living now in the United States. So 80 and older more than there are individuals who are 2 years or younger in terms of new children being born into this into the world in the United States. Mental health and well-being are very important in older age, and I really acknowledge that as I'm blessed every year to get 1 year older, and I am in that senior age category. According to the World Health Organization, approximately 15% of adults aged 60 and over suffer from mental health disorder. Mental health problems are under-identified by healthcare professionals and older people themselves, and the stigma surrounding these conditions make people reluctant to seek help. That's one of the reasons why we wanted to host these series, because we wanted everybody to know that there is no stigma in the being involved or seeking help as a result of trauma or conditions you live under, the stress that we have each and every day, mental illness. All of those things should not be things that we hold stigmas to, but understand that it's a way of life, and there is help out there. There are programs out there. There are institutions out there, governmental and private institutions, that will be able to assist and guide people through these traumatic episodes that they may have, regardless as to whether there are episodes that lead them to a facility like a hospital, or there are episodes that just cause a lot of stress and strain in their daily life, of which we all experience that. Tonight, we will be learning how and where to access services for older adults, get an understanding of some of the concerns older adults and family members, as well as learn about the tools to address older adult mental health wellness. With Kate Jones and Dr. Lynn Trinh O'Leary, Kate Jones is the Director of Adult and Older Adult Services for Alameda County Behavioral Care. She is a nurse with a master's in healthcare leadership and a master's in rehabilitation psychology. Kate has worked in the field of mental health with both adults and youth for more than 23 years. Prior to her work in mental health, Kate worked with individuals with intellectual and developmental disabilities. She is particularly passionate about creating partnerships to provide quality behavioral health services to Alameda County residents. And I want to say a big thank you for taking time to be with us tonight. But also, more importantly, thank you for all of the services that you've been giving to adults as well as youth over the last 23 years. We'll also be joined tonight by Dr. Lynn Trinh O'Leary. She is the Director of the Program Operations for the Felton Institute. She joined the Felton team in 2017 as the Director of Programs for the Senior Division in San Francisco, and now Felton is over here in the East Bay and expanding. She has since engaged in projects in Alameda County in the startup of the Older Adult Service Team Program, Adult Protective Case Management, and reentry programs in the Justice Division. Prior to joining Felton, Lynn spent over 15 years working with individuals with severe and persistent mental illness in communities, mental health settings in San Francisco, Alameda County, as well as Contra Costa County. Lynn's clinical experiences ranges from school-based counseling, organizational psychology and consultation with teachers and faculty members, partial hospitalizations, individual group therapy, psychotherapy, as well as trainings. She is also involved in housing projects, assisting with older adults in finding permanent housing. Lynn earned her master's and doctorate degree in clinical psychology from Alliant University and her BA in social ecology from UC Irvine. After the presentation, we'll have time for some questions, so you can write them down or send them to us in the chat. And we look forward to your questions. But also remember that even after this is over, there will be a list of resources that you will be able to identify with. And if you have follow-up issues or questions, please feel free to reach out to any of the resources that we are going to highlight. So again, tonight would not work without you logging into the final episode or the final session that we're having on community mental health. And it clearly wouldn't happen tonight without having the expert presentations from Ms. Jones and Dr. Trinh O'Leary for presenting this evening. And I want to say again, thanks to both of you for taking time out of your busy day to be with us this evening.
Thank you, Supervisor Carson. Thank you for the warm introduction. And I want to thank all of you for attending tonight's fourth part in this series about health and wellness for our community for all ages. I'll begin the presentation by talking a bit about what Alameda County Behavioral Health does, who we serve, and how to access services. And then I'll hand over the rest of the presentation to Dr. Lynn Trinh O'Leary from Felton Institute to talk to you a little bit more about the issues facing older adults and some strategies to address them. And as Supervisor Carson stated, we do have a list of resources for all of you to access at the end of this presentation. So let's get into our presentation here. Having a moment of technical difficulty, please excuse me. There we go. So tonight's goals for our community mental health webinar series on older and aging adult health and wellness. How and where to access services for older adults. Our second goal is to understand the concerns of older adults and their loved ones. And then lastly, how to address older adult mental wellness. Alameda County Behavioral Health Services is, that is who I work for, as the Director of Adult and Older Adult Services. So who do we serve? Sorry, folks, there seems to be a bit of a lag, so please bear with us. Alameda County Behavioral Health Care Services our adult and older adult system serves adults that are 18 years and above who have serious mental illness that is moderate to severe and or whose substance use seriously impacts his, her, or their day-to-day activities of daily living. Individuals who are Medi-Cal recipients, Medi-Cal eligible, Medi-Cal and Medicare recipients, often referred to as individuals who are Medi-Medi, and health PAC recipients. We serve all of those individuals. So how do you get your loved one services? That actually sometimes is the most important question that people have. We have a website for Alameda County Behavioral Health that you can get onto that has our access number on there, and that can give you some important information. But I want to share with you a couple of different ways on how people might enter our system. So common entry points into our system are individuals who might go to an emergency department for various different reasons. They might go there for instance, an emergency psychiatric hold, or they might go there because they were in a car accident or something else happened. They had a fall and they were taken to the emergency department. And then maybe some mental health issues are discussed with that individual at that time. Individuals go to our crisis stabilization units, Amber House, which is our voluntary crisis stabilization unit, or psychiatric emergency services over at John George is another entry point into our system. Oftentimes people are referred by family, or they might refer themselves through our access line. And our access line performs eligibility and screening and referrals for specialty mental health services in Alameda County. And then other programs and services in the county. Someone might come into contact, for instance, with one of our mobile crisis teams. Dr. O'Leary and myself might be walking down the street and interact with somebody, or over a period of time, for instance, unhoused individuals in our county. So there are a myriad of different ways that people do actually enter our system. And for those that do not qualify for specialty mental health services, so there may be some of you on the phone where somebody is Medicare only, or you have a commercial insurer. So for instance, Kaiser or HealthNet, for instance. So for those that don't qualify for Alameda County Behavioral Health Care Services, there is Alameda Alliance, for those that might be considered more on the sort of moderate side or even mild side of having a mental health and wellness issue. So if you have Alameda Alliance as your insurer, that's a way. You can contact them on their 1-800-9 number. Anthem Blue Cross also insures individuals with Medi-Cal, and they have a 1-800 number. And then Kaiser Permanente also provides Medi-Cal insurance. Alameda Alliance provides over 80%, somewhere between 80 and 90% of Medi-Cal insurance for individuals in our county. And then if you have a commercial insurer, you can get on and call their customer service line and ask them about the benefits that they have for mental health. That should be clearly outlined by the private, otherwise known as commercial insurer. So please take a moment and call them regarding their benefits. So what are our services specific to older adult services at Alameda County Behavioral Health? We have what's known as the Geriatric Assessment Response Team, GART. That team goes out into the community when they are contacted by an emergency department, by our access phone line, by, for instance, Felton's. A family member can call our GART team, and they do assessment and then referrals. So they might go and assess somebody in a hospital, they might go and assess somebody in their home, and then refer them either to our services because that person is felt that they qualify for our specialty mental health services, or refers them to other programs that are appropriate based on what they have found in their assessment. We have our older adult service team that Felton Institute runs. That's a case management team specific for individuals that are 60 and above for our specialty mental health services. We also have what's called Circa 60, and that is the full service partnership that is run by Bay Area Community Services, and that is an intensive case management. So the case management ratio is smaller on our full service partnership team, and then they have a couple of more staff that are integrated into the team for an intensive case management teams. And then we also have Morton Baker Center. That's our mental health rehabilitation center. And that is a subacute environment for individuals that are about 59, 60 and above who need to have some additional time to stabilize after having a crisis episode and then an inpatient acute stay. They might go to Morton Baker for further stabilization and work on things like activities of daily living in order to go back out into their previous living situation. General mental health services that are available through Alameda County Behavioral Health. We have assessment, therapy, psychiatric medications, case management, consultation, and medication support. And we now have urgent medications that are walk-in. We have case management and intensive case management services that provide care coordination and support to individuals that need that level of care. We have inpatient hospital, as I referred to earlier. Our inpatient hospitals provide acute hospitalization or subacute hospitalization. We have housing and support services like supported residential living. We have employment, and we have outreach and engagement teams for early intervention services. We also have community integration services for transitioning individuals from the criminal justice system. We call those reentry services. And we have our prevention and early intervention services for underserved English limited proficiency individuals in order to get them served in the language of their choice. We have a host of other services, but we want to move on. Those are the core elements of our services. So that's just a brief introduction to Alameda County Behavioral Health Services. Now I'd like to hand the presentation over to Dr. Lynn O'Leary from Felton Institute. Lynn?
Good evening, everyone, and thank you so much for having me here this evening. Thank you, Supervisor Carson. Thank you, Kate, for this opportunity. So for those of you who are not familiar with Felton Institute, I'd like to give you all a brief overview of Felton. So Felton Institute, formerly known as Family Service Agency, we have been around for 132 years. Our CEO is Al Gilbert, and we provide services in 5 different counties: San Francisco County, Alameda County, Marin County, Monterey, and San Mateo. We serve our clients in 11 different languages, and we have over 50 programs to support our clients in the community. And our core services include early care and education, mental health, family support, social and justice services, training and research, and aging services. Now, specifically to our older adult service team program, we've been around in Alameda County for over 3 years, and we're very excited to participate and collaborate with Alameda County, and our older adult service team program supports older adults living in Alameda County with severe persistent mental health issues to age in place. Our objective is to improve the lives of older adults living with comorbid mental and physical illnesses. We offer specialized multidisciplinary geriatric mental health services, such as medication and assessment care management, case management, individual and group therapy, community integration, and specialized community outreach. We use evidence-based frameworks to assess and treat our clients, such as patient care, patient-centered principles, harm reduction, trauma-informed care management, CBT, cognitive behavioral therapy, and other philosophies of care. So let's move on to the next slide, Kate. Kate?
Yeah, sorry, Lynn. I'm sorry. We're having that moment of, there we go. Okay.
So when we work with older adults, older adult population, a very vulnerable population, especially during the COVID pandemic, they're at most risk. So when we're working with older adults, we need to consider all the challenges and issues that older adults face. So we are looking at mental health and behavioral challenges, such as depression, isolation, unable to attend to their daily living, skills. And then we have psychiatry and geropsychiatry. That means, when a person can receive appropriate and psychiatric and medication care management, a med provider who specializes in understanding comorbid mental and physical illnesses, differentiating between the differential diagnoses. And then we also have conservatorship. So helping a client link up, an older adult client link up to conservatorship and understanding conservatorship. We have the public guardian conservatorship, and we have the Lantern and Petrus short conservatorship. We have housing, so we need to consider the housing, the lack of housing for our older adults, and then older adults not being able to advocate for housing. There's health and medical care. Being able to link up to health and medical care is always an issue. And then there's lack of social support. Lack of family support is an issue. And then also losing loved ones, not having that, the support. Transportation is an issue for our older adults. Not being able to get to their appointments is a big issue. Then there's food and nutrition.
Dr. O'Leary, sorry, it sounds like it seems like you might be having an echo on your mic. I don't know if there's anything you can do to try and
let me move closer to the
adjust.
Yeah, is that better?
People were saying it sounded echoey, so
let me see if I can change this. I'm in my office, it's a little bit better.
That seems a little bit clearer to me.
So
are you on your computer or on a phone?
I am on my computer.
On your computer, okay.
I'll move closer.
Okay.
If that helps. So I apologize. So
thank you.
Nutrition, age-specific resources and supplies. How do you help an older adult navigate to get resources and supplies? For example, incontinent undergarments, walkers, wheelchairs. Financial assistance. A lot of times older adults are unable to attend to their financial needs. So how do they actually pay for their bills? We need to consider that. And then there's specialized risk assessment and management. So when there's a crisis that comes up, how do you manage crisis interventions and crisis stabilization? And then we have substance abuse dependence. So for older adults, where do they go to get support for substance abuse support? And then the next one, societal attitudes towards aging adults in the US dominant culture. So there's ageism going on, right? And then being able to connect to services and having the appropriate services for older adults. And then lastly, social-cultural factors. So for example, if you consider our older adults, there's so many social cultural factors that we need to consider. For example, where they came from, immigration. How many services have they gone through before they received the appropriate care? Also, for example, all the hospitalizations that they've gone through, and then also, all the different providers that they've had to work with. So these are the main ones that we consider. So you can go into the next slide. So how to figure out what's happening with me, my loved ones, my friends? Is it mental illness, dementia, or physical illness? So when currently right now, when we're working with older adults, it is not standardized for us to discern between dementia type diagnosis from thought disorder. But at OST, our medical provider uses MMSE, which is a mini mental static exam, or the MOCA, which is the which is a Montreal cognitive assessment to determine, establish the baseline of cognitive functions of an older adult. And when we talk about the baseline of cognitive testings, we're measuring for the older adult's brain function in a healthy state. So we treat older adults, their psychiatric disorders, when we treat them adequately with antipsychotics, the chronic progression of cognitive capacity declines. So when we consider in working and we treat with antipsychotics medication, we have to consider, does it carry a risk of dementia-related adverse effects, or is there a risk versus benefits analysis? So at OST, our medical provider does a medication regimen analysis to consider, can we consolidate medications, or can we reduce the non-essential medications that may carry cognitive adverse effects? For example, we all know Benadryl. Benadryl causes and carries cognitive risk. So these are the things that our medical provider considers. So when dementia, it is really important for us to work with primary care providers. Next slide, please. So strategies to support our older adults. So one of the main things that OST, we work very hard is we provide case management for our older adults. We help our older adults in navigating the medical network system. So how do you navigate through all of these insurances, and how do you work with the different providers? So case management is really necessary. Linking access to medical providers, that's another thing that is considered. For example, when you're working with an older adult, how do you help them navigate and connect to medical providers? We work with, for example, Lifelong. So Lifelong, when we transport the client to the medical provider, and we work and collaborate, our medical providers talk to their medical providers to make sure that there's a cohesive, an overall understanding of what's going on with the client. We also help identify age-appropriate resources and supplies. And then there's obviously advocacy for housing, legal, medical, food, and financial needs. So we also assist older adults in community integration. That's the next one. So we help build relationships with providers. It's really important that you do that. So in the community, when you're working with our adults, it's a collaboration. It's necessary to build these networks. And so we also support and bridge digital divide. A lot of our older adults don't have the technology or are unable to navigate that. So what we do is we support our older adults in helping and closing that gap of digital divide. We also provide telehealth services. A lot of times our older adults are not able to come in, and during the pandemic, we were able to provide telehealth services. Education and support in using technology, that is constant. We work and collaborate with providers. We work with licensed board and care housing managers to help to make that happen. We support the older adults in how you use technologies. And lastly, we find social programs. A lot of our older adults are isolated. So what they need is, to be connected to programs in the community so that they have some sort of social network support. Next slide. Psychiatry. So psychiatry and medication care management is really important. Getting the assessment that is necessary. So for example, medication assessment. When you do the medication assessment that is necessary, you have to understand the different types of medication that is involved. If there is concerns for dementia, then we work with the primary care provider to get a neuropsych assessment for our older adults. So education around medication is important. Our medical provider provides education. So when we sit with each client, we go through the medications and the side effects. And then mental health resources. It is very important that we connect our clients and support them through all the resources that they need in order for them to live independently or to navigate the system. Communicating with family members and care providers is very necessary. That means it's a consistent communication. So for example, for me, I'm working with a client. I make sure that the client is able to, if they don't have technology, I will go use my phone and work with the client to call their family member, or if they're living at a licensed boarding care, or I call the family member to update them on the care that we're providing, so they feel reassured that we are doing what we need to do to provide services for our client. Creating a social support network is very necessary. So we always encourage our clients, do you want to go to groups? There are groups around. Even right now during the pandemic, connecting them to maybe Zoom groups that's necessary out there. So we try to connect our clients to these social support networks so they're not alone and isolated. Creating a system to track appointment and changes, that's really important. So part of what OST does with most of our clients is help them through that. We have a team of, nurse practitioners, our registered nurse, our case managers, our clinical case managers, and even me. I go out into the field as well to support our clients. And we help our clients to track these appointments and provide them these appointments. So for example, helping them using calendars. How do you, put your appointments on calendars to make sure you don't miss your appointments? Calling them prior to their appointments the day before. You remember you have an appointment. So those are the things that we work with clients to support them on. And then the release of information, making sure that we have a release of information to talk to the providers that are necessary to provide that care. Lastly, end of life planning. So this has been, it's a difficult one. And, some of our clients, they have medical ailments. One particular client that we work with has cancer. How do you work with somebody to help them? So we have our team. I call it, we have a team. So when I introduce OST, I say that you are working with a team, not just the individual case manager, but you have a team to support you. So the person knows me, knows my nurse practitioner, so that they feel like they're getting the support they need. We do discussions on end of life planning. We help them through. So your trust, what do you do with trust? How do you manage that? And then we also connect them to services such as Alameda County Care Alliance. So Alameda County Care Alliance, they have navigators, care navigators that help identify and address needs for our older adults in end of life planning. Next slide. So strategies to support family members and caregivers is also very important. As a caregiver and you're taking care of an older adult, you have to figure out, gosh, it's exhausting for me. How do I get support? What do I need to do? So the strategies that we come up with to help family members and caregivers is, education around fall risk prevention. What do you do? How do you change your home to make sure that, your loved one doesn't trip, doesn't fall? making sure furniture is, certain tables are moved out of the way, making space for, walkways, making sure that there's a ramp if there's anything that's needed to make sure that your loved one is safe. Education around safety in home and residence. Support to connect with social workers to provide comprehensive support. So that is something we do. So for example, you don't know how to navigate the system. So how do you do that? Strategies, for example, working with Kaiser. So what we do is we would help support the family members. Okay, so here's what we do. We'll call this person. How do you get to that person? What is this for? So kind of helping staging and giving them some sort of outline to follow so they know what are my next steps to care for my loved ones, and then how to manage depression and isolation, not only for your loved ones, maybe for you, just helping you go through and receiving resources, support for yourself, and saying, how do I manage my feelings right now about what's happening? So we support, family members and providing them resources. We also provide psychoeducation around medication management, how to manage and administer medications at home. So our medical provider works with family members and caregivers to make sure, hey, here you go. If your family member, if you have to, do it where, you do bubble packs, making sure we order the right medications in bubble packs for their loved ones so that they don't mix up their medication. Or if you can't do it, how do we set up with an IHS care provider and have them come in to support your loved ones in administering the medication. And then tracking medication changes and interactions. That's really important for older adults. So what we do is we make sure, hey, do you notice of any changes? Can you tell us what's going on? So kind of having that constant communication with family members and caregivers to understand if there's any interactions that are happening. So for older adults who are living in licensed boarding cares and assisted homes, we call the providers. We make sure we call every month there's somebody calling and asking, how is this person doing? How are they interacting with us? Are they sleeping? Are they not sleeping? So these are the things that we make sure we ask so we understand, are there any changes? Next slide, please. Oh, the last one, provide opportunities for choice. We want to make sure that you have a choice as a family member to care for your loved ones. So you have a choice in the services that you want for your loved ones. So here's a list of all the resources that is included in supporting older adults. I'm going to open it up for questions.
Thank you, Dr. O'Leary, and let me turn my video back on. And thank you, Kate, for your presentation. If you have questions, you can ask them anonymously through the Q&A box, or you can raise your hand and I can allow you to talk, and then you can unmute your mic and ask your question. So again, you can put your questions in the Q&A, or you can raise your hand to ask your question, and I can allow you to talk. So well, let's see what we get here. If there are any questions. I have Moni. Please unmute your mic and ask your question.
Yes, thank you very much, Dr. O'Leary. My father is 83 years old and in a boarded care facility that we found, which was more affordable and a very nice place. But they seem to have less standards, of course, than a assisted living facility. So I do find that it takes a rather diligent advocacy for a family member to ensure things are happening. Like they didn't know he had dentures for 2 weeks, 3 weeks. We assumed that they take his dentures out and find that out because I visited and realized that. Or, nails aren't clipped on a regular basis. And so, or didn't have a checklist. They didn't have a checklist when he came in to know that these are the things this particular resident's in need of. So I'm creating that for the owner. Are there standard requirements, sort of like what they are expected to do and have with regard to daily care and maintenance, et cetera?
So I do know for licensed boarding carers, they have a different standard and they follow under community care licensing. So if they're not doing what they need to do, they follow regulations, then you can call the ombudsman office and let them know, hey, these are the things that they're not doing. I know for licensed boarding carers, they administer medication. They do provide more staffing than assisted living homes. And also, you know, the monitoring. So there's more, maybe possibly depending on the level of care that they're in, they could have more of a 24 or maybe, you know, more strict rules around having older adults or people wandering. So if they're not following the regulations, you know, you can actually find it through community care licensing.
Thank you. Other questions? You can raise your hand to ask a question, or you can put it in the chat.
I have a question. What is a consistent request that one gets regarding individuals who are older adults, either regarding trauma or actually dementia or moving towards mental illness? Is there kind of categorically a larger number of individuals who may reach out for a specific need in the mental health area?
So for OST, when we receive referrals coming into OST, we usually, our older adults have a chronic mental health condition. And so what we do is we look at that, we do an assessment based on that. Our medical provider comes in and then does the psychiatric assessment for medication. If there's shown cognitive decline, we use our assessments to determine that. And then what we do is we collaborate with other psychiatric providers, previous providers that have serviced them, or we look at what's going on with their medical concern. We try to connect them with Lifelong to make sure to rule out any sort of, you know, is there dementia? Are there dementia type issues going on here? Cognitive impairments, we analyze that. And then once we were able to see that, and if we can determine that the primary condition is more still mental health, then we focus on that. And then if the cognitive impairments are there, we work with the client to help them, you know, repair that if we can.
And how do you address, unless Kate, did you want to respond to? I'm not sure.
Yeah, I would also add that the physical health providers, you know, we do serve individuals who develop dementia, and they are welcome, and we serve them throughout the lifespan in our system. However, if somebody is referred in our system, which is not uncommon, individuals who have cognitive impairment, and they will end up at emergency departments. Sometimes they will end up at John George. These things are not uncommon. So what happens is Lynn was referring to, is sort of a differential diagnosis between, is this really a mental health issue? Is this a cognitive impairment? Does this person have a urinary tract infection? Or maybe are they even responding to medications and changes in their medications or a medication buildup? And are they having delirium, which is a sudden onset of symptoms that can look a lot like severe mental illness? So those are the kinds of things that are not uncommon, that are seen in our more acute kind of parts of our system. But GART and OST do actually address these issues frequently.
I have a question that our office receives on a regular basis, and that is in the area of older adults that completely have all of their legal rights and everything. Sometimes family members are torn between trying to, without the consent of the older adult, their parent, trying to get them assistance and help. How do you navigate that minefield of someone having their rights as an older adult and then they're being observed by a loving family member, but yet and still are not really able to take more progressive action in terms of attempting to assist their older loved one.
So this is where, we do run into this quite a bit too. So for example, this is the conservatorship comes in, but if a client does still have capacity to consent to advocate for their medical care, we work with the client, even though there's a decline in their mental health. We work with the client to make sure they understand that, look, can you do the following? Can you make decisions? So it's a process. It's not an easy process because it's not a quick fix. So a lot of times what happens is they can advocate. There's a capacity that they still can. We cannot push and we cannot tell the loved one, you can step in to take care of that. So that's something that we try to work with the client on, and it takes building relationship and having them understand their condition so that somebody can step in to support.
Thank you. We have a question from Carol Afua Yates. Please unmute your mic, Carol.
Is it unmuted now?
Yes, we can hear you.
Okay. I have a couple of friends that, we've known each other a long time, but we're not really keeping in touch. And I feel whenever I call from time to time, that they are feeling alone and at home. And I know the person, really was a music person. So I'm wondering if there are music sessions that a person can be taken to if they're feeling a little depressed and alone, or if, there are classes that seniors can take, if they know how to play music or want to learn how to play music.
So what we currently right now, because of COVID, we try to connect clients to more Zoom type groups. And right now, it is difficult. I'm going to be honest with you, it's not easy. And it's navigating the system of trying to find these groups. So one of the things that OST is trying to do is that we are trying to establish going into licensed board and care assisted homes and working with the providers there at the facility to say, hey, can we run a group? Can we provide support for our client, for the clients there? There are groups online, and I'm more than happy to provide some resource for you if you would like to just let me know, and I can get that to you.
Thank you, Lynn. Can I also just add a little bit there too? Yes, right now it is very challenging, and older adults are having to do more things online, as all of us are, as evidenced by tonight's presentation online. The Center for Elder Independence, which we have in our resource guide, the Area Agency on Aging are both really good resources to reach out to that individuals can get a host of ideas and recommendations on the services that they're looking for through both of those agencies. And you should find them in our resource section at the end of the presentation.
Okay, I have two questions that came in on the Q&A. The first is, are you finding higher rates of dementia with Black elders? A recent seminar that this person attended stated alarming figures. And then if someone is level 6 of 7 in dementia, are there ways to freeze that worsening dementia? And then I'll let you answer that one first.
Kate?
Sure. So I'm sorry, Amy, could you please repeat the question?
Yeah. So are you finding higher rates of dementia with Black elders? And then if someone is a level 6 of 7 in dementia, are there ways to keep that from worsening?
Thank you for that question. As far as higher rates, I don't know the specific statistics based on race and gender and culture for dementia specifically. So I don't really have a specific answer to that question. If one were to look at health equity statistics, I guess you could deduce that it would be reasonable that older adults who identify as Black or African American would have higher rates of dementia. But I honestly, I don't know the statistics, so I don't want to give you misinformation. As far as where someone is on stages 6, 7, or 8, so more in the sort of moderate to severe, going into what would be considered more advanced dementia. There are some clinical trials going on right now for new medications for cognitive impairment, otherwise known as dementia, if you get that formal diagnosis. I am not aware of anything right now that stops the progression. There's nothing to cure. There are medications available that assist in slowing the progress, but I am not clear. Most of them are really sort of for the sort of earlier stages of dementia, but there are studies right now going on for more moderate to advanced dementias, but I do not know the results of those studies.
Thank you, Kate.
Thank you. Our next question is are there non-traditional supports for elders experiencing challenges, specifically like culturally responsive groups?
So there are some resources that we listed in the back. So there's support groups. There's the Alzheimer's Connect organization that can support older adults facing that. And then the Institute on Aging also has resources and availability to support older adults. Of course, Center of Elders Independence also has support for these types of issues that are coming up as well.
Great. And then what type of support is there for caregivers who take care of someone who had a stroke?
What I could say right now is if that individual is an individual who qualifies for Medi-Cal or currently has Medi-Cal, in-home support services through our social service agency is an excellent resource to apply for having in-home supports. When in-home supports come in, it's really an opportunity for the loved one who is taking, or friend who is taking care of that individual, to get some respite. So that's an excellent resource for individuals.
Great. If there are any other questions, you can put them in the Q&A. You can raise your hand and I can allow you to talk. Any other questions? Okay, well, I will give it over to Supervisor Carson then to wrap us up for this evening.
Well, first, I want to thank Kate Jones, who is the Director of the Adult and Older Adult Services for Alameda County Behavioral Health, as well as Dr. Lynn Trinh O'Leary, the Director of Program Operations for the Felton Institute, for giving us a wealth of information, quite a bit of information for people to digest and take in, but valuable information. I want to say thank you so much. It does outline what are some of the resources that that are out there for us. And I know that a lot of times it may take a little bit more thought and digesting of that information before you are able to kind of act on it. For all of you who participated and kind of chimed in or tuned in over the last month, we really hope that this has been at least valuable information for you to share and for you to use. Just know that there are so many institutions and organizations and community-based groups and help groups from cradle to grave to try to assist us as we navigate the stresses of every single day, the trauma of every single day, the tensions that we have throughout the day, regardless as to age or race and ethnicity or economic situation or educational situation. We all have these feelings and trauma, and everyone is susceptible and is diagnosed. It is possible to be diagnosed with mental challenges and mental illness. So this is really something that is valuable that not only we hope you collected, but that you're passing on. This event was recorded and we'll be posting it on our office, my YouTube channel, which can be found by searching Keith Carson District 5 on YouTube. Let me repeat that. You can find it on our YouTube channel, which is Keith Carson District 5 on YouTube. If you enjoyed these series, my office is hosting another 4-week series starting next week, particularly focused on the African American mental health issue. And you can register for that at bit.ly/Black M, capital M, capital H, 21. So let me say that one more time. At a small casing, bit.ly/capital BLACK, capital M, capital H, 21. This link is in the chat so that you can also pick it up there. Also, all 4 of our recordings and their presentations will be sent out to everyone who registered and will be posted on my webpage, which is www.acgov.org/Carson. I do want to say again, a big thank you for all of you who have tuned in to all of the series or parts of the series or even one of the series. Those who took time to be panelists and inform us, from the Healthcare Agency Director, Dr. Karen Tribble, who kicked off our series on mental health, and all of the programs that Alameda County has that are internal to the county and that we contract out, almost like with the Felton Institute. Those programs that are in our school systems. Even though school is just now starting to reopen, we have mental health services in K through 12. We have mental health services in First 5. We have mental health services for seniors. We have mental health services that are available for anyone here in Alameda County. And so I want to say thanks to all of the presenters. The information that you provided is invaluable, and hopefully people will use it. So check us out beginning next week for the series that is really focused on mental health and the African American community. I know there was a question tonight about in terms of mental health numbers and the African American community. I'm sure that some of that will be made available over the next several weeks as we have the series. This could not have happened without Amy Schrago, Chief of Staff for our office, who just does an incredible job every single day, 7 days a week. And I want to say a big thank you to Amy Schrago for setting up this series, for overseeing the operation of the series, and for making sure that the material is there for people who may come back later and pick it up. And so also for making sure that we were able to provide language for groups that needed additional assistance in picking up this information, including for those who may be deaf. And so again, thank you, Amy, for all that you do. Thanks to our panelists. And as important, more important, thanks to all of you who checked in. Share the information. Have a good evening. Thank you.
Thank you all. Good night.